So we now have Romie, who is Romie Luxton. She is a midwifery advisor for the NMC and represents the Advanced Practice Review in England. And she's going to give us an update on ACP and nursing from the NMC. So welcome, Romie. Lovely to see you. Thanks so much for being flexible on your timings, your presentation.
That's okay, not a problem at all. It's nice to be here. So, as you've just introduced me, my name is Romie. I work for the NMC now full time. So, part of the time, I am the midwifery advisor for England on the Advanced Practice Regulation Review. And then the other half of my time, I work as a senior clinical advisor in the Fitness to Practice team. So, it's lovely to be here today. Can I just confirm you can see my slides?
Yep, can see your slides. Yeah, thanks,
Lovely.
Romie.
That's great. Okay. So I don't know how much everyone on here is aware about the current position in the NMC in terms of regulating advanced practice. But we started phase 1 of our review in response to some independent research that was carried out by the Nuffield Trust. And that highlighted some key potential risks to the public of advanced practice roles, predominantly around the large variation in how those roles work and the lack of employer governance. But then there were also some latent risks associated with diagnostic and that kind of in-depth history taking. So we prepared lots and lots of different papers, looked at worldwide research. We've done lots of stakeholder engagement events, so with employers, with current AP, with systems regulators, and that was all taken to the NMC Council earlier on this year, and the council decided that that there was a need for additional regulation. There were various options that were presented, but the council felt that full-scale regulation was what was needed to provide public protection. So how that's going to look is there will be standards of proficiency for advanced level practice developed. There will be education programme standards and accredited programmes within universities. We are adopting a collaborative approach, so that's a UK-wide framework, so that's across all 4 nations. There will be a shared position or definition of an advanced level practice, and what's also going to happen as a result of this, that anything that we decide within this regulation review will also then be considered as part of the revalidation review and the review of the NMC code, which is scheduled for next year. So within this phase 2, we are, as I say, developing that UK-wide framework. We are drafting standards of proficiency, and part of this is a public consultation and wider stakeholder engagement. We are drafting some programme standards for university, and we will also be including within that the quality assurance and implementation activity plan. We're very conscious to make sure that this is a proportionate approach. We want this to be fair for current advanced practitioners or advanced practitioners that are currently training. And again, this will all link into that planned review of revalidation and the code. So as you can see from this slide here, the first stage is the regulatory principles. So that's going to include a definition of advanced practice. And it's been decided that that's going to be a public first definition. So rather than having a definition that's more appropriate for professionals and one for the public, we're going to have one that's just appropriate, so public first. So anybody reading that is going to understand that. There are no kind of technical terms or anything that a general person would not be able to understand. So then we are going to look at what knowledge and skills are going to be needed for advanced practitioners, and that will feed into our standards of proficiency. And the way that people can go in to have their annotation on the NMC register as an advanced practitioner is going to be one of 2 ways. So for those that have not started their training, it will be going via one of the approved education programs, and then the other route will be that transitional process. So I'll speak slightly more about that in a second. And then once that individual has met all those standards of proficiency, they will then have that annotation on the public register in the same way that you do as a health visitor or as an independent prescriber. So we have various work streams within phase two, and this first one here is that UK wide framework. So we're thinking about principles. So that's just really high level principles that look at what those expectations are for advanced practice nurses and midwives. And then linking in and working alongside those principles will be that definition. So again, these are just the steps. So when we're looking at those principles, we're doing this with wider stakeholder engagement. This isn't something that we're just coming up with within the NMC. We have got lots of people involved in this, including, ARCOG, the anaesthetists. We have got the GMC, we've got the CQC, as well as public and employer stakeholder input. And we're also working with the joint regulatory group. So that is the CQC for England and then the equivalents for the other 3 nations. So workstream 3, which is probably the one that is of most interest to current practicing advanced practitioners and also advanced practitioners in training, is how we're going to do that transition approach. So we want to make sure, as it says here, that it's robust, it's fair, it's proportionate as well. What we don't want to do is create something that means APs have to jump through lots of hoops and undertake lots of additional training to get that annotation on the register. So the way that we're approaching this is working with, so in Ireland, the NMBI, they have recently undergone a similar process. So we're working closely with them. And we're also looking at international models as well, how they have managed that process. And as it stands at the moment, it looks like we're going to go down more of a credentialing route. So I know the RCN have a credentialing pathway at the moment, so do the Centre for Advancing Practice. So it's going to be similar to that. So something like a portfolio, obviously this is all very much in consultation, so this isn't the final, but it's anticipated that it will be portfolio type approach, whereby advanced practitioners can go on there and map their skills, map their experience, map their education, their educational qualifications, and then that will be submitted to the NMC. That will then be independently reviewed. And then there will be the decision, whether, yeah, absolutely, this is great. You can be then annotated as an advanced practitioner, or maybe we just need a little bit further evidence, or actually, no, we don't think that your skills and your knowledge map to that. So here's a bit of a plan. So we don't want to make this too complicated. So this is the biggest challenge, I think, for us out of all of the work streams, is that transition. And I'm going to provide some contact details at the end, but I'd really, really appreciate any concerns that you've got, any input, any feedback, anything that you think would be helpful for us to consider. And there's also an opportunity for you to register in our community of interest as well. So one of the things that we're doing at the moment is a survey. So we need to find out how many advanced practitioners there are on the register. For nursing, this appears to be slightly easier, whereas for midwifery, because sometimes the terms specialist midwife, enhanced midwife, consultant midwife, advanced practitioner, sometimes they're used quite synonymously. So we need to try and get some data around how many practicing APs we believe there are. And then, as I say, go through the transition process, then that will mean the annotation on the register. So we're also going to be developing some guidance for professionals. And as I said before, for those that don't initially go through the NMC process of getting that annotation, we will provide some support as well, and also support for educators, students, and employers. So some key considerations for us here, as I say, we don't want any unnecessary barriers. We want to make sure that we can continue to build the numbers of advanced practitioners across nursing and midwifery. So we don't want to make that any more difficult. EDI, a massive consideration for us. We need to make sure that this opportunity is open to our internationally educated nurses and midwives that might not have done a master's within the UK. So we need to look at how we can measure that equivalence of the qualifications that they've brought to us. And then also we need to look at the impact on the students as well. So for those that are just qualifying from the currently non-approved advanced practice programs, so we need to look at what different approaches we need to take. And then also the timeframes. So if we're putting in a transitional process, do we do that for 2, 3, 4, 5 years? How long does that process need to be in place? So again, this is something that we're going to be working with lots of different stakeholders to come up with these answers. And again, I know I've touched on this, but we're working with international regulators, the UK healthcare regulators, as well as I say, the RCN, the Centre for Advancing Practice, and lots of wider engagement.
Romie, can I just stop you whilst you're pausing there for a sec?
Of course.
What slide are you actually looking at on your presentation? Because we're still seeing slide 4.
I'm on slide 10.
Okay, yeah. So the slides aren't moving through. Do you want to see if you could just share it again? Oh, we're nearly there anyway. Yeah, that's fine because all of the attendees will have access to your slides and your
Yeah,
recording after this,
yeah.
and you're explaining it so well that actually it's fine.
What
Not
I'm going to
to
do is
has
I'm going to stop sharing and then I will just come back onto camera, because, as you say, I can share the slides afterwards. And
Yeah,
also on there is my personal, well, not my personal email address, my NMC email address, the generic advanced practice NMC email address, and also a QR code for the community of interest. So very happy for people to contact me and would really like to hear from people actually if you want to arrange individual meetings or small group meetings. The engagement is a big part of this review. So anybody that's interested, please do let me know. And I think I just wanted to give that real brief overview. I know I've kind of done a bit of a whistle stop through that, but as it stands, we don't really know how everything's going to look. We have to go back to the NMC Council in January. Actually, no, it's moved to February now. So we're going to go back to them and present the work that we've done to date. So we're anticipating that will be that public first definition, the high level principles, and how our transitional arrangements are going to look. We don't have to have it fully finalised by that point, but they're the ones that we need to be presenting in February. And then going forward from that, we'll be looking at those standards for proficiency. We'll be looking at the education standards as well. So this isn't an overnight project, but equally, there is tight timescales on this because of that latent risk, potential latent risk to the public that's been identified. We're very keen in the NMC to get this moving. So yes, so it's not going to be something that takes years and years and years to develop, but equally we want to make sure that it's done properly. So I'm very happy to take any questions that anyone's got.
thanks so much, Romie. That was brilliant. And yeah, in the absence of the slides going through, it didn't make a difference actually, because I've managed to follow that extremely well explained. We've got a couple of questions.
Mhm.
What role will a job description have, if any, as evidence within um, that new assessment route, accreditation route?
Yeah, so absolutely. When I'm looking at the other credentialing schemes that have been done, both for advanced practice and equally other roles as well, the role profile, the job description, they're all really important to be submitted within that portfolio of evidence because it outlines their kind of scope of practice or should outline their scope of practice. One of the problems we're seeing a lot with advanced practice, particularly in midwifery, is that lack of employer governance. So it's that lack of a clear job role. It's that lack of the kind of defined responsibilities. So it's very much hope that as part of this work, that can get a little bit tighter, which actually for the professional themselves, for me, that would make me feel a lot better. If I know exactly what my scope of practice is and I know my areas of responsibility, hopefully it should give more reassurance to the AP. So yeah, it's going to be very important. Other things that might be used are things like written reflections. There could be some some case studies of examples of care that you've given. Could be some supervisor feedback. So all of these types of things are generally what goes into the portfolios.
Great, thanks for that response. We've got another question. I'm I'm a digital badge holder, so this is really valid for me too.
Mhm.
Would I have to submit additional academic information on top of the digital badge scheme, which already outlines the academic criteria reached?
Yeah, so again, we're working very closely with the Centre for Advancing Practice, and we're very, acutely aware that their process is very robust. Within the NMC, in terms of this credentialing process, it's very unlikely that that will be done internally. That's almost certainly going to be done by another organisation. And so, for instance, the Centre for Advancing Practice, they have got really good processes in place. So it may be decided that there are collaborations with other organisations, and we will absolutely be respecting the process that they've put in place. As I say, it's very robust, and it would be stupid of us and not proportionate of us to therefore ask for lots of other hoops to be jumped through. So yeah, absolutely something we are considering and making sure that we don't overcomplicate this process. So I know I can't give a definitive answer to that, because obviously we are still undergoing the review, but it won't be wasted time, I suppose, is what I'm going to say.
Oh, good. Yeah, that's good to hear because for those that have undertaken the e-portfolio route where they've had to work for up to a year or more sometimes with a university lecturer and submit reflections and evidence on numerous different areas. It would be good for them to hear that they don't have to go through a process similar to that all over
Mhm.
again after having met the requirements of HEE.
Yeah, absolutely. And for those that have gone through the portfolio route, you've kind of one step ahead because you've already got lots of this information already gathered. So it's certainly not going to disadvantage you. It's going to be very, very helpful in the process going forward with the NMC regulation.
Yeah, I completely agree. I work in different settings where, yeah, there's a need for more of a framework around ACP to support with job descriptions and scope, etc.
Yeah,
A national approach. A couple more questions.
absolutely.
Do we have any idea how many ACPs there are working with a triage maternity setting? Do you know
So in terms of
specifics
numbers
on?
at the moment, very, very difficult to say. But the survey that's going to be going out, hopefully October, November time, we're hoping that that will give us a little bit more insight. So at the moment, we've got various ways that we've been able to gather data, but it's absolutely, it's not a robust method. This has been kind of speaking to units, and then, there's certain groups that I'm aware that are set up where people, network. So it's kind of saying, oh, well, there's that many there, that many there. And I know the University of East Anglia done some research as well, and at that point, I think they identified around 90 midwifery advanced practitioners, but now we know that number is higher. So in terms of areas worked, it's very difficult to quantify, but we're around the 100 to 120 mark for advanced practitioners that we know of at the moment. But as I say, during this transitional process, what we might see happening is some specialist or enhanced midwives coming forward saying, actually, I feel like my skills, my experience, my education would meet that of an AP. Just because I'm not working in that role, actually, I feel like I can fulfill that criteria. So we might have some people come across like that then are successful at going through and having that identification as an AP. And we might have some consultant midwives as well that want to do the same thing, that want to have that annotation on the register. So it's going to be very, very difficult until we're a little bit further down the line to be able to say, to be able to quantify exactly. So I know that's not very much help at all. I certainly know of a handful of triage advanced practitioners, probably 5 to 10 that I could say off the top of my head, but I'm sure there are many more.
Yeah. Oh, thanks, Romie. We've got a few more questions, so we've got another 7 minutes if you don't mind, hanging on with us.
Yeah, of course.
Topical, of course. The
Mhm.
another one, I'm going to read it out. The RCM statement was equivocal. How can ACP professionals lobby for themselves? They're not sure of their support of ACP midwifery, and it's a concern. This is,
Yeah,
and
so
this ties in with, I'm aware the RCM have recently published a statement and definition of AP. Are they involved with the NMC work?
yeah, so I'm sure, and I know it's no secret. I work with very closely at the moment with the RCM. Their stance on practice in midwifery has changed quite a lot over the last few years, but now they are very much on board with the concept. Their biggest concern is that the crossing over between the obstetric colleagues and the midwifery, and that we're not, just to, I know Cara uses this term quite a lot, you know, that maxi midwife, not mini doctor. And I think that's consistently the message that's coming through from the RCM, which is why they are working very closely with us on this review. And that collaboration is, it's very, very strong. And I know that their statement that was put out, as you say, it might not have been too detailed. And yeah, I'm not sure on the actual phrase that was used, but what they didn't want to do was make that too specific and put too much direction on that whilst this NMC review is underway. So it was kind of flashed in front of my eyes before it went out for publication, but we couldn't comment anymore. We couldn't elaborate anymore because of the stage that we're at with the NMC review. So, but I can say that they are very supportive of the work that the NMC are doing. So, and they're very, very pleased to see this work being taken place, and equally are wanting to promote these roles more. So, I'm hoping this regulation work as a whole, it identifies the fact that, yes, this is a thing. We do have advanced practitioners in maternity. We do need advanced practitioners in maternity, but let's just make sure that we're doing this safely to protect the public and also the professionals that are doing these roles. So I think it's going to be a good thing for maternity.
Yeah, yeah. And thanks so much, because you're in a position where you're able to tell us directly what's going on, and that's such a gift for us attending this day. So thanks so much for coming. But I've got a couple more, if you don't mind. I've
Yeah,
got
no,
4 minutes.
no,
Um, so we've got someone who's, hang on, let me just go back to that because there's more coming in.
Did you
Yeah, I
want,
think
Julie,
we've
I've got the
answered that.
questions up now. Did you want me to just skim
Yeah,
through these? Yeah, it
yeah,
might
that
be
would be
helpful.
great. Let's look at them together. Yeah, have a look, see what you
Yeah.
think.
So, revalidation period. Yeah, there's no plans at the moment to change the frequency of revalidation. But as I mentioned earlier, there is a review on revalidation as a whole, along with the NMC code that's planned for next year, or 2025, 2026. So at the moment, yeah, no plans to change. Then we have got advanced practitioner working in acute areas in an operational role. How would I stand to still practice as an AMP in line with the service if I need to keep my portfolio up to date with the competencies? So that's a difficult one to answer, really, in terms of submitting your portfolio. If you are evidencing working across the 4 pillars, and at that advanced level practice, this isn't going to be about job role. This isn't about specific jobs. This is a level of practice rather than the specific jobs. So as long as you can evidence that you're working at that level, I would just say keep portfolio up to date. For anyone that's here, if you have any written reflections, if you have any case studies, any feedback, just kind of keep that ticking along in the background in preparation, I suppose, would be my advice. Sorry, I've got workmen in here. I do apologise if you can hear lots of drilling in the background. I was going to do the e-portfolio route as I have a master's in advanced practice, but not advanced clinical practice. Should I hold off and wait for this change instead? Okay, so if I understand this correctly, I know that some universities, such as say Anglia Ruskin University, they used to run the advanced practice in midwifery masters, but that's not an advanced, an ACP masters as such. For those people, again, that would be looking at the equivalents. So there might be that there's a couple of modules that you need to undertake, but not a whole masters. So I would say, unless you really want to go ahead and start that masters, or undertake another couple of modules, maybe just hold off if you don't need it for your current role. But the other thing I would say is you're not going to be wasting any time. If you're undertaking any further learning, it's only ever going to be a good thing. So but how that's going to look, the accreditation of programs, that's obviously going to take quite a while. So it may be that we haven't got any accredited programs up and running for 3 or 4 years. So I think that's going to be entirely up to you. But as I say, any additional learning that you undertake at this point won't be wasted. So, and if you're going to go down the portfolio route, again, I would say that's not going to be time wasted, because it's gathering all of that evidence, and the chances are it's going to be a very similar process that the NMC adopt. So yeah, I would say probably in that sense, don't hold off, because it'll be good preparation regardless of the outcome. Are there any other questions, Trudy? I couldn't see
No,
any
I
others.
don't think so. And it's oh, hang on, one's just come in. I'm aware the RCM have recently published a statement. A no, hang on, that's no, that's fine. That's a repeat of the old one. Good, Romy, thanks so much. Excellent information, and thanks so much for stepping in this time slot.